We're seeing big demand on emergency departments with minor ailments when really they could be seen in the community more appropriately. We know that when children do present to emergency departments with minor conditions, that they're the same things that they keep coming back with. And it's a short list of common conditions that make up the vast majority of our workload in emergency departments. In particular, we're seeing the under 5 age group presenting to emergency departments with conditions that could be managed well in the community. And in fact, it's the biggest group out of the whole population that's really could be managed in primary care and community settings. The types of conditions that we're seeing are things like wheeze and breathing difficulties, fever, diarrhea and vomiting, and other common things like constipation. And really, health visitors are well placed if they feel confident and competent in knowledge and skills for these minor conditions to be reassuring families and helping them navigate the system and seeking the appropriate help so that they avoid ending up in emergency departments when they could be being seen by the health visitor or their GP. Health visitors are in a really unique position to provide support for families around managing minor conditions. We know that health visitors are the professionals that families consistently meet and have the chance to build a relationship with. Before children end up in emergency departments, they've often ricocheted around the community and seen several different professionals or a professional a couple of times before they eventually end up being seen in the emergency department. And really, if professionals working in the community, like health visitors, along with the GPs, are developing their knowledge and skills to feel confident and competent in managing a lot of these minor conditions, then we can avoid that experience for families and help them get their care closer to home. The health visitor has a really unique and privileged position working so closely with families and building relationships with them, that they can really have a vital role in helping empower families to manage a lot of these minor conditions themselves at home by giving and sharing their knowledge and skills with families to release their own resourcefulness and help children stay at home where possible when they're unwell. It's important for all professionals working in child health to keep up to date with the management of conditions. Even these common conditions that we've been seeing present to emergency departments for years and keeping us busy, the management of them can change in time, and there's good comprehensive evidence-based guidance that's regularly updated on sites like NICE and the SIGN guidelines in Scotland, and also on the Royal College of Paediatrics and Child Health website, all of which would be really important ports of call for professionals trying to maintain their competence and their knowledge and skills. Training health visitors in the management of minor conditions could really help reduce the pressures on the system, not just in activity, but also the costs that we're currently seeing in the system. It's extremely more expensive for children to end up in emergency departments than being managed in the community, and we could be saving hundreds of millions of pounds for the NHS if these children were being managed at home.